Brookfield Zoo staffers are heartbroken following the sudden death of a newborn dolphin. This is video of the male bottlenose dolphin calf swimming alongside its mother after being born on Saturday. The zoo says that calf was meeting all of its milestones and seemed fine, but last night the calf's health unexpectedly and rapidly declined. Zookeepers say that the first few days of a calf's life are very fragile. An autopsy will be done to reveal the cause.
But at the end of the day, we were hoping to do one last ultrasound check on her and the calf, and she had no interest, and that's a huge change in pregnancy. We do ultrasounds at least twice a week on her through the duration of her 12-month pregnancy, and tonight at 7 o'clock, she had no interest in food or in participating with ultrasound. So we
do ultrasounds at least twice a week on her.
Recent warning from the FDA shows a different picture, telling women to avoid ultrasound scans. In the warning, it says ultrasounds can heat tissues and in some cases produce very small bubbles or cavitation in some tissues. We talked with Dr. Dawn Palacheski at Tampa General Hospital about the dangers.
If these little bubbles form, they can eventually collide and cause shock waves to the tissue around them, which could actually destroy the tissue. This has been used for things like liposuction in the past, but it's not necessarily something you would want to happen to your babies.
Are we talking about the tissue of the mother, or are we talking about the tissue of the baby?
We don't really know. Yeah, it's just one of those things that the long term, there might be a biological effect long term that we don't really know about yet, so we should try to minimize using the ultrasound.
The American Congress of Obstetricians and Gynecologists, known as ACOG, an organization of women's healthcare physicians, has said for a long time that ultrasound should only be used if there's medical benefit to the pregnancy. It's known in laboratory conditions that ultrasound can cause this issue with a tissue, so the assumption is the same thing is happening to a woman when she's pregnant.
I would recommend not doing one solely for entertainment purposes. I would follow the advice of your physician or midwife and only get ultrasounds during pregnancy if they're absolutely needed.
But in the 10 years Christine Fremer has been with Meet the Baby, she's never had concerns over whether it's safe. There's no limit on the number of times a mother can come here to get a 3D ultrasound.
For this reason, it is recommended that ultrasound exams be performed only for medical reasons by qualified health providers. So they're not really saying they're bad, but they do recognize there could be some risk. I also don't think they're looking to stop doing them. Now, in the circles that I hang out in, there is some risk. So first, ultrasound machines generate heat, and they may heat above maximum safe levels, especially when the wand is held in place for longer than 2 to 3 seconds. Dopplers have been shown to cause significant heating, especially in a baby's brain. There are a handful of studies that show some risk. So a study from the University of Washington found a higher presence of autism in boys who were exposed to ultrasounds in the first trimester. A study from the UK found women who received 2 or more Doppler scans to check the placenta had more than 2 times the risk of perinatal death compared to babies unexposed to Doppler. Other studies from the 90s, when ultrasounds were much weaker, showed increased risk of miscarriage or preterm birth. Studies from China point to ultrasounds increasing risk for autism, ADHD, genetic damage, jaundice, childhood cancers, and allergies. This could be all related to increased body temperature, which are known to have risks. That's why they tell you to not take hot baths. One study found brain hemorrhages in mouse fetuses when they were exposed to ultrasound doses similar to those used on human babies. Another found a 22% reduction in the rate of cell division and twice the rate of cell death in the small intestine when exposed to ultrasound. Even though this is a study on animals, I think this is one of the most important pieces. It is known that ultrasound is capable of deforming cell membranes, and this can happen in both the brain and obviously other tissues, although the brain is at most risk since it's such a complex organ. And this risk is known amongst practitioners, and it's one of the primary reasons you really do need an experienced sonographer to use it. There are a few more examples of studies done that show adverse effects. I'll post a link to those in the description if you want to read the studies, and I'll also link to a Mom at Natural blog post that has a lot of this information and a lot more, as well as testimonies of what other women have done in terms of ultrasound. An important note, though, is ultrasounds do not improve outcomes. Studies have been done to show this. In fact, another reason I didn't want to get the survey is because false positives are common, which then leads to even more ultrasounds and a lot more stress on the mom, which isn't good for mom or baby.
Modality. Ultrasound, also known as sonography, involves a specialized unit that produces high-frequency sound waves that are emitted from a blunt probe or transducer. These high-frequency waves pass through a patient's organs, causing vibrations, and are either absorbed or reflected by the subject. The reflected signals are detected by the probe and translated into a diagnostic image for interpretation. However, there is evidence that when ultrasound is applied to soft tissue structures such as the peritoneum and colon, it is possible for patients to develop air bubbles from the vibrations. Although rare, these air bubbles can exacerbate into more serious conditions that require additional treatment. For this reason, many doctors discourage frequent exposure to these studies, particularly for pregnant patients. But the key here is moderation. Non-diagnostic ultrasound, when acquired for random purposes or simply to see the baby one more time, is regarded as irresponsible and unnecessarily assuming remote risks.